I think I have another minute to say good morning to all of you. As the Bishop of the Washington Episcopal area, it is an honor for me to stand here this morning to be a part of World AIDS Day for a number of reasons. United Methodists are truly committed to a world that would one day be free of AIDS. Our church has long been committed to creating an AIDS-free world. In 2005, we created the United Methodist Global AIDS Fund as part of a global health initiative to raise funds to support church-oriented and Christ-centered HIV and AIDS ministries. The fund, I am proud to say, has been distributed to over 175 projects across the world, including the U.S., and the need for continued and increased funding for programs of HIV and AIDS education, prevention, care, and treatment is everywhere evident. I'm sure that, as many of you are aware, that our founder, John Wesley, practiced medicine himself and called his followers to care for the sick and suffering and to avoid any kind of discrimination. That is why at our last General Conference in 2012, we endorsed the new 2020 vision, an AIDS-free world, campaign of the United Methodist Global AIDS Fund Committee. Now let me introduce to some of you our guest of honor, Congresswoman Eleanor Holmes Norton. She is a delegate in the U.S. House of Representatives for the District of Columbia. She is a tireless advocate for the health and well-being of this great city. Congresswoman Norton is a third-generation Washingtonian, 12-term member of the U.S. House of Representatives, and tireless advocate for the residents of the District of Columbia. In 2008, Congresswoman Norton successfully removed a rider from the annual Financial Services Appropriations Bill, banning the district from funding needle exchange programs. Before her congressional service, President Jimmy Carter appointed her to serve as the first woman to chair the U.S. Equal Employment Opportunity Commission. The Congresswoman's work for full democracy for the people of the District of Columbia continues her lifelong struggle for universal human and civil rights. Congresswoman Norton cares deeply about our brothers and sisters who daily struggle with HIV and AIDS. That is why we are honored to have her to share her wisdom with us as we look to that day when this world would be free of HIV and AIDS. Won't you join me in welcoming and greeting our Congresswoman this morning?
Thank you very much, Bishop Matthews, for your very kind introduction. And I thank you and the United Methodists for inviting me to say a few words before your distinguished panel meets. This is the first day of Congress since the election. And it is a day where I need to rush back to the Hill. But it is also a day when I needed to be with you and with my constituents as we commemorate World AIDS Day here and the world over. This is the moment, at least at noon, the White House will be commemorating World AIDS Day as well. what's most important is not what we say today, but what we do today. And the kind of commemoration that is happening all over the District of Columbia and in the states, throughout the United States and across the world are not only events to promote awareness, but testing for AIDS. That is putting into action what we're trying to emphasize during World AIDS Day. I remember when the AIDS crisis began, and I hope we haven't lost sight of what were the words then, safe sex. We have reports now that parts of Africa have eradicated the Ebola virus. It comes back, but there are whole sections now where this deadly virus, in spite of the lack of a health care infrastructure, is being eradicated. We're on the brink of a vaccine for Ebola, and I'm pleased to report that there is tremendous progress for a vaccine for HIV as well. Until then, all the watchwords need to be heard, from safe sex to testing, because this is a virus that does not have to be. And I know you share with me what the loss of human life means when you could prevent it. You know, when you hear that someone has died of some form of cancer that you did not know what to do about, that is something that we still have to do research about. But when we say we should be able to eliminate HIV and AIDS, we mean it. It is human contact that transmits it. And its great tragedy is that it falls most heavily on the very young. We do know this, that there should be no baby born with HIV today, and shame on us if there is. In this city, for the last 3 years, I believe it is now, we have not had a single baby born with HIV/AIDS. This city has become a model for how to eliminate HIV and AIDS. And well, we might have. Because this city was the special focus of the Congress of the United States in the days of woeful ignorance. I should say willful ignorance. Because all of the scientific evidence, all of the great scientific establishment of the United States said one thing you want to do to contain the spread of HIV is needle exchange programs. For 10 terrible years, I fought to get a deadly rider off of the DC appropriation, and each year that it remained, HIV was spread throughout this city, and there was little we could do about it until the District of Columbia, the nation's capital, became the epicenter of the AIDS, HIV epidemic in the United States. My good Christian friends, that did not have to be. And it was man-made in the Congress of the United States. Of all the riders that we have had on us, and we now have only one left, and that is a rider that keeps us from using our own local funds to help low-income women who need an abortion. That's the only one remaining. But none has had the effect on this city as the needle exchange rider had. I can say without hesitation it was a life and death effect, and that thousands died in this city because of the Congress of the United States. When I say we have become a model, almost the moment that we got that rider removed and DC could get into the streets with needle exchange programs, the needle exchange transmitted virus began to disappear almost immediately, so that today it is down almost 90%. If anything tells you what that rider meant to the District of Columbia, and what it really meant was the spread of the virus. So then the district had to work with needle exchange there on containing the virus, and it's almost impossible to do. As long as you cannot keep the virus from being transmitted, whatever you do will not stop the transmission. And so we now have our 2 wards east of the Anacostia, where women and men have AIDS at the same rate, my friends. That would not have happened were it not for the rider. So almost all of the progress we have made can be linked back to the elimination of that rider. And that progress is so remarkable, I want to, after having told you about my great frustration at the spread of AIDS, I want to say just a word about what that progress has meant. We have gone from within 3 months now of discovery of the virus, people, almost 90% of people are linked to care. Late testing has decreased. I'm going from 2008 until today. Late testing in 2008 was about 56% of the people. Now it's down to 44%. And the district now has been able, now that it's contained the spread through needle exchange, to make real progress. More than 4 times as many people are being tested. Nothing is so gratifying than going to one of the sites and seeing people wait to be tested. Waiting to be tested was to have a stigma painted on your forehead. Now people wait to get their free testing. Lifting that stigma has been most important to all the progress we have made here. When we found that the failure to have needle exchange program, the denial of the needle exchange program meant that we had the highest AIDS rate in the United States, you have to think of what we're talking about. Just down the road in Baltimore, a much poorer city, because they had needle exchange, they had a better AIDS rate than the District of Columbia. Well, the District of Columbia is finally catching up, and we found our people more than receptive to the various modes we use to catch up. Today, we've increased 14-fold the number of male and female condoms that are distributed. In just 1 year, and here's my favorite, of course, we've taken what was 500,000 needles off the street. It's now up to almost 250,000 needles off the street. We have in this city treatment on demand. The effect of that, of course, has been to draw the virus down year after year. When you see that kind of progress on a healthcare indicator, you know you are getting somewhere, particularly with a disease which is transmitted from one human being to another. Perhaps, finally, those who benefited most from the Affordable Health Care Act have been people who have been tested for AIDS. Now, your pre-existing condition cannot keep you from being treated. So imagine before that time, what difference does it make? I don't have the funds to be treated, so why should I go be tested? The link is clear. In this city and in some states, we have expanded Medicaid coverage. So that means that people who qualify can get their treatment through Medicaid, and you don't have to be among the poorest of the poor because we raised the income limit. The lowering of prescription drug costs has had extraordinary beneficial effects for people living with AIDS, HIV and AIDS. And the spread of clinics throughout the District of Columbia who are able to treat HIV and AIDS. So you walk into a clinic, you don't know who has what because they're there for everything from high blood pressure to a common cold, and yes, HIV AIDS. These methods have enabled us to reduce our own lamentable place in the country for HIV AIDS. We will not be satisfied until worldwide we have eliminated this virus. We want and we can get an HIV-free world, beginning with United Methodists who are spread throughout the world. Let that be our goal. Thank you for what you're doing this morning.